you gave us the support. You approved our bills and you are passed. Chair, as read from the submission of my Cabinet Secretary in terms of progress report, you have given you an update of where we are. Indeed, we are at that particular time, moment where we are now pulling out. We've said this system that is being developed is not going to be a perfect system from day one, but we will soldier on with the challenges we are facing, because as mentioned by Honorable Maingi, this system requires a lot of integration. For example, we are integrating with the National Registration Bureau, which is a data from the government agency mandated to collect the data of Kenyans, and we are saying our system should be able to read and reference to that. Chair, sometimes we could experience downtime, as mentioned by Mary, Honorable Mary. If NRB, for example, experiences downtime, we expect even us to experience a downtime because of the integration of the system. But we are working closely and collaboratively with the NRB system so that when they are facing downtime, they quickly move in and rectify the situation. You've talked about the private insurance based on your contribution. We are telling Kenyans, you still have the option to obtain or get your private insurance. What we are saying is, under the social health insurance, we're saying this is a national scheme, and therefore all of us are contributing to the national scheme. And you're saying we want a figure that everybody will, to be used for everybody. That 2.75% is what we'll use. So that amount will go to the social health insurance, but if you feel that you need to have another private cover, this act or this insurance law does not prevent you from going for it. How much we collect? The projections, our projections is about 148 billion Kenya shillings. Our projections, with expectations that Kenyans will faithfully pay what has been assessed of them and based on their income. We also project that we might have more yield, and as we get more yield, we will be able to give more benefits to Kenyans. Honorable member has asked, Kibageni asked, we are paying too much, we are getting from it. Our initiative, we say that we must have a base where we want to pay. We say we will not come below the national health insurance premiums that are currently being paid. Where we have assessed and we need to enhance, we have done that, and it is there. Benefit package, we submitted the benefit package to you, honorable members, and again you gave us approval. Honorable members, we are moving this journey. We are going to, all of us, we have did you today. We are giving you a progress update of where we are. We expect still a lot of support from you in terms of telling Kenyans to contribute to the social health insurance, because we also realize that all of us belong to a community. All of us come from our society, and we face challenges. The big thing that we identified, which you also said it is true, is that we are going into out-of-pocket expense, which is going up. Harambes is what we want to kill. We might not kill today, but in the future, we shall kill the Harambes. Now let me go to Honorable Martins. I know people, tomorrow, most of them, as you say, they will be energized, they will wake up and say, let me go to the hospital. What we have done is we have had engagements with the Council of Governors, we've discussed with them, we've told them to stop, and particularly level 2, level 3, which there is a primary healthcare fund. And we are saying to access the primary healthcare fund, what a member needs to do is register. Once a member has registered,
beings as you live there, when is FIF becoming functional?
It is functional.
It is not. It is not.
According to the report you got
where I come from, it is not functional. Where I come from, yes, even the dispensary next to my home, the money they get even for deliveries goes to the county account. Even the women who are delivering there, the family have to carry food for them, because the maternity cannot even cook for those women because all money is going to county account. Food, if your relative delivers there, you have to take food to them. So until FIF is functional and governors tell you the truth, until FIF is functional, we still have a big problem.
Vice Chair, it is functional in some counties, and some counties it is not.
All that is the Principal Secretary for Medical Services at the Ministry of Health, currently present before the National Assembly's Health Committee, answering to questions if the ministry is ready for the rollout of the Social Health Authority that is tomorrow. Now, the members have also raised concerns over the readiness of the means of testing, payment by those in the informal staff, among other issues that have been cropping up within that particular session. Our able reporter, that is Kamche Menz, is currently attending the session and will duly inform us in our subsequent bulletins.